Bismillahirrahmanirrahim. So let's begin with lip histology and welcome to Ordinary Days. So now this lip histology, first of all you should know that major muscle which is present in the lip is a skeletal muscle which is orbicularis oris, that is helping me to modify or move my lips, and that skeletal muscle is embedded in a fibroelastic connective tissue. Now the lip is composed of this whole region. Now it has this cutaneous surface, a vermilion zone, and an oral surface. It has three major surfaces: cutaneous surface, vermilion zone, and oral zone. You can remember this by mnemonic CVO: cutaneous, vermilion, and oral zone. Now, this cutaneous surface, it is actually the skin which is made up of hair follicles, but it does not have hair present, but it has hair follicles. So the skin, which is devoid of hair but with hair follicles and has sebaceous and sweat glands. So first is cutaneous surface with sebaceous and sweat glands and hair follicles. Then we have vermilion zone or red zone or red area. Why do we call this red zone? Let us have a look. First of all, you need to know that it has an epithelium and a lamina propria. The epithelium is this stratified squamous keratinized epithelium. This is stratified squamous. They are squamous cells which are present in the form of layers and have a thin keratin surrounding it. So stratified squamous keratinized epithelium. And in from the lamina propria, there is this projection which are papillae, and the papillae they have blood vessels surrounding them. And due to that papillae having blood vessels, it is given a red color. That is why it is known as vermilion zone. So stratified squamous keratinized epithelium with papillae, and the papillae have the blood capillaries as well as sensory nerve endings. So this is the vermilion zone. And this vermilion zone, it is not supplied with any glands. It is not having any sebaceous glands or sweat glands. So how does it stay moist? It is made moist by the means of saliva. Now we will talk about the oral surface. This oral surface, that is the innermost surface or towards your oral cavity, that surface of your lip, it is having the stratified squamous non-keratinized epithelium. This was with thin keratin, but this is non-keratinized epithelium. Like the above one, it also has these trabeculae or papillae. These papillae come from the lamina propria. So stratified squamous non-keratinized epithelium with connective tissue papilla and a lamina propria, and that lamina propria has these glands. These are labial salivary glands which are mucus gland. You know, the labial glands and buccal glands, if you I show you the labial glands and buccal glands, both of them are mucus glands. So this labial glands which are present in the oral surface of your lips, they are salivary glands which are mucus glands, and they can be simple SNR or tubulo SNR. So cutaneous, vermilion, and oral part. Cutaneous, which is skin, having hair follicles, sweat, and sebaceous gland. This one having stratified squamous keratinized or thin keratin epithelium with papillae, and papillae have blood capillaries, also has sensory nerve endings, kept moist by saliva, has no sweat and salivary glands. And this oral surface, which is stratified squamous non-keratinized epithelium with these connective tissue papillae and labial salivary glands, which can be tubulo-SNR or simple SNR, and they are mucus glands. So this is about the lip histology. If you like my way of teaching, please like, share, and subscribe. And if you have any queries, please ask in the comments below. And you can leave a good comment as well because it really helps me.